Hi, everyone. I'm Dr. Jennifer V. Brown, your stroke specialist, and today we're going to discuss why is cardiorespiratory fitness important after stroke. Cardiorespiratory fitness is important because it's an indicator of heart and lung efficiency. We need the heart and lungs to work together to get oxygenated blood to the brain after a stroke or a hemorrhagic event. So the heart has to work extra hard when there are problems with it. The first being there's an increased workload on the heart when there's systemic increase in blood pressure, like the narrowing of the arteries throughout the body. Also, when you have an arrhythmia, the most common being atrial fibrillation, the heart may throw out coagulated blood, which goes to the brain and can cause a clot. The heart may just have damaged muscle, that's a cardiomyopathy, and it may not be able to contract efficiently to get oxygenated blood to the body and to the brain. And last, you may have coronary artery disease, the narrowing of the arteries of the heart, and therefore the heart tissue does not get oxygenated blood, or those arteries could go into spasm. Now let's look at the lungs. How does it impact getting oxygenated blood to the brain? Well, you may have an airway disease like COPD or asthma. So air cannot flow through those big tubes to get to the lung. You may have a lung tissue disease like pulmonary fibrosis. So now the parts of the lung itself are hardened and it can't expand and contract. You may have pulmonary vascular disease, in which the arteries and veins of the lungs may get clogged by traveling embolus. All right, so coagulated blood. And then you may have fluid accumulation or infection, the most common being pneumonia. And last, it may be a structural mechanical issue of the chest wall where you don't expand and contract, allowing the lungs to inflate or deflate, or you may have a collapsed lung known as a pneumothorax. All of these issues can contribute to oxygenated blood not getting to the brain where it's needed. So now you may not be getting enough oxygen in the blood itself. And this reduction is caused by quite a few things. So it can be a diffusion defect when the alveolar and the capillary barriers may be clogged. And so you can't have that oxygen exchange. There may be a ventilation perfusion mismatch when the lungs receive air, but there's not enough blood flow to get the air and extract the oxygen, or vice versa. You may have hypoventilation in which there's inadequate air movement, and so you have an increase of carbon dioxide left in the blood, but decreased oxygen. And last, shunting. Blood passes through the lungs with no exchange of oxygen. So these things cause a reduction in the oxygenation. And if there's not enough oxygen in the blood, even though you have blood flowing through the brain, it's not carrying oxygen and other nutrients that the brain needs for neuroplasticity. So these are some clinical questions to ask. Am I getting enough oxygenated blood to the brain, specifically the penumbra, which is the yellow area here in this picture? Number 3, the red area is the infarct. That brain tissue is dead. So how do you get oxygenated blood to the penumbra? You have to engage in high intensity exercise. High intensity exercise requires that you have muscle movement. Sometimes that's difficult to get because the cortical spinal tract that goes to your arms and your legs has been damaged by the stroke. And then you have other descending tracts take over. And you may see the arm and the legs move in synergy pattern. That doesn't mean we can't move. We just don't move normal. And it may take a little bit more effort to move in those synergistic patterns, like a bent arm with an extended leg. So you lack hip flexion, knee flexion, and foot clearance. But there are things that you can do on a body weight supported treadmill, them a bicycle, a new step that a seated bicycle or a new step in order that you can get that aerobic high intensity work. And you can use battery operated modes to help you move your arms and your legs. The second thing is, how do you determine the intensity at which you should be exercising or engaging in physical activity after a stroke? This is where your physical therapist comes in. You have to use this Carbonian formula. It's your target heart rate. That's what you, for the intensity. It's your maximum heart rate minus your resting heart rate times the intensity, the percentage of what you want to do. And then you add that to that resting heart rate again. All right. That intensity is anywhere from 60 to 90%. You may be on medications, and so there's no need to go to a much higher percent because the intensity may be blunted by the type of medications you take. The research shows, and I have found, most people post stroke can work harder, but they are not. And I tell folks, if you want to get better, you got to break a little sweat. And when you're trying to talk, you should be huffing and puffing, at least zone 2 or higher. I know we engage in exercise. We walk, but sometimes we're walking casually. We're on the new step and we're just talking and we're moving casually. But if you really want to help get oxygenated blood to your penumbra, high intensity work, and it can be anything. You can be raking leaves, just put a little bit more force in it. You can be engaged in an exercise or physical activity, and you should try to get that target heart rate. Have your physical therapist calculate that number for you, and you can use wearables like a watch or some type of monitor to determine if you are getting at that high enough intensity. Remember, I'm your stroke specialist as a trusted source for all things ankle foot orthoses and neurorehabilitation. And don't forget evidence-based practice to improve clinical practice. Thank you for watching this video. Remember to subscribe, like, and share, and leave a comment. Bye.